I'd like to call on Dr. Kevin Kavanagh, representing Health Watch, for his comments.
Thank you. The CDC estimates that 20% of resistant bacterial infections in humans comes from food and animals, with the vast majority of the rest associated with the healthcare industry. In the 1980s, we closed entire wards if there was a single infection of MRSA. In the early 2000s, the public was reassured that MRSA outbreaks are under control and legislative mandates are not needed. The latter assertion was bolstered with poorly designed research, which shed doubt on the effectiveness of surveillance and isolation. Next, the industry advocated to treat all patients the same and for the use of universal daily bathing with chlorhexidine. However, a recent study in The Lancet found this to have limited effectiveness on general hospital wards, and accompanying editorial recommended the chlorhexidine use should be limited to situations with a clear patient benefit. Now that MRSA is endemic, some hospitals view these infections as no big deal and nothing for the public to worry about. Some facilities are not even performing isolation of MRSA patients, arguing that healthy individuals have little to be concerned. Advocates have heard similar narratives regarding Candida auris and CRE. However, pathogens are most efficient when they only affect the sick and the frail. And this equates to a shortening of our lifespan because we almost all age and develop chronic illnesses with a drop in our defenses. We need to stress the importance of a healthy patient's microbiome, initially focusing on the identification and elimination of dangerous pathogens. But of utmost importance, we need to protect our healthcare workers, who may well be acting as reservoirs to spread these pathogens to both patients and their families. An economic safety net needs to be established, and medical screening needs to take place. Until these reforms are enacted, I have grave reservations that this epidemic will be brought under control. Thank you.